Okay, so these lines basically LA nasi, from LA nasi, just go front, mark the upper medialmost part of the eyebrows. Then from LA nasi, go up to the mid pupillary line and see where it transects the eyebrow. So that's your highest arch point. And then from LA nasi, from the lateral canthus will be the tail end of the eyebrows. We'll discuss it again and again till the time you remember it. So density of the eyebrows is, where do you see it's the maximum? In the medial side, the maximum bushy eyebrows are there. So nowadays there is a trend of having a ombre type of pattern where you also give a blading technique plus you do a brushing. So we are not discussing brushing today. I'm only going to talk about the blading technique today, but I'll also tell you about it. So how was the eyebrows in 1915s? I somehow feel 50s mein jo fashion tha, the same is trending right now. Can you see the same? So the eyebrow fashion has been also changing, not only the clothing and stuff. So 50s, 60s were ekdam straight, bang straight, 70s, 80s, 90s, 2000s, and this is the new trend which is present. So it also depends upon the type of face which you have. So the simple funda is, whenever the face is long, don't give an arch, because that will give a longer look to the face. When the face is long, make it flat. When the face is short, make it arch. Simple. So when the face is oval or long, you make a flatter eyebrows. When the face is square or anything else, which you can see everywhere the same, soft arch, you can still do with a soft arch, but don't make too arch, because that does not look nice. Imagine Alia Bhatt with a brow with arch. It will not look nice. So similarly, it really makes a lot of difference. For male eyebrows, we're not discussing too much about male eyebrows because we don't really make about the arch and all. It's just a flat eyebrows which is encouraged there. And a brushing is more trending than a blading technique there. So few lines, glabellar line is the medialmost line. From the center of the nose, straight, you go up. That is the glabellar line. Medial line is from LA nasi to medial starting of the point of the eyebrows. Just go straight. Lateral line is from the nasi to lateral canthus and then go. That marks the tail end of the eyebrows. Okay. Medial one, LA nasi say the medial most origin of the eyebrows. So that is the medial most ka marking. Lateral is the lateral end. बीच में क्या आएगा? एक ही point है, interpupillary line. So उससे line घुमा दो, that will be the highest point of the arch. Simple. 3 lines: medial, lateral, medial from medial, lateral the last line from the lateral canthus, and then the interpupillary line से जो भी pierce करके जाएगी ऊपर, that will be your arch, point of arch, highest point of arch. So these are the few lines needed. Now in the picture, just see very carefully. See medial line. You can see LA nasi. This is the glabellar line. This is medial line. This is the pupillary line se jata ho, highest point of the arch. Then this is the lateral most end of the eyebrows. Starting of the eyebrow. Not medial canthus. Lateral canthus ही सिर्फ use करेंगे इसमें, बाकी कुछ नहीं. So photography technique is very important before you start doing microblading. You have to always keep the patient against a transparent background. It can be black or gray, whatever you have, or a simple piece of cloth which can be blue color or green color. Take a picture and always show her the marking before you start it, because she should be very happy, because ultimately she has to resonate with her eyebrows. So if she's happy with some people, how much ever you want the ideal to give the ideal shape, they might not be happy because you have done what she wanted to. You are there to guide them. This is what will look nice on you. But still, if they want a little bit of tweaking, then you can do that for, as a tailor-made technique for your patient. So we are talking about, so like I said, this is the medial most line. So this is glabellar line. Then there is a medial line. This is the highest point of arch. Then from the LA nasi, this is the lateral most end from the lateral canthus. So this is the tail end of the eyebrows. Now tail end is always little higher than the medial lower end. So just whenever you draw, keep this in mind. Different shapes are trending now: high arch, low arch, S, rounded, straight. Now, itna nahi, you just have to learn about high arch and soft arch. That is what most of the people would come to you for. Instruments, what you need, we have everything here: microblading pen, scales for instrument, blades, ink holder, everything. All this is, what are the different types of ink? What ink do we use and what should be used? So we are using iron oxide or synthetic, but what we use is synthetic dye. Why? How is it different? Iron oxide dye is basically combination is a brown color or dark brown color. Teen combination है, yellow, green and orange color. ये तीनों का combination होता है. So whenever it is exposed to sun, it's more prone for fading. So you would when you see against the sunlight, you will see the tattoo fading to brown color, reddish color. So but microblade will never happen like that, because their pigment is deposited deep down and there is no such 3-color mixture. It is artificially created. So it fades to dark brown color. So it even looks better. So that's why synthetic colors are what we prefer. Does ink fade over time? Of course, it lasts for 1 year to 1.5 maximum. Then after that, it fades, and you need to do a touch up after 2 weeks. How to do your brows based upon your face shape? Eyebrow shape as per face structure. Low arch or flatter eyebrows are better suited for long oval faces, like we have discussed, and high arch more suited for round face. Like, look at our face. Just keep looking at different type of faces. I have just kept this so that you can see different types of faces, and then you decide. Look at the eyebrows also when you're seeing this picture. Now look at the eyebrows also here. Look at the eyebrows, how it is looking flatter, and why is this, and how would a flat one look here? So look at this typically round face, and because of the arch, her face is looking slimmer. In fact, it can also give a little slim look to your face. Look at this square face. Square faces give a good symmetry. Of course, there are many things which can be done to this face to make it look oval, and we talk about in Botox and stuff by jaw Botox. But here we are discussing about which type of blading technique, microblading technique, and eyebrow shape will look best on this face. So heart shape face, look at soft arches maintained here. Look at the oval face, because the face is already so long. If we make an arch, it'll not look so good. So this is what is looking the best for this type of face. So to recapitulate, if you have a square shaped face, try soft rounded brows. So soft rounded and square face. If you have a rectangle shaped face, try slightly curved brows. Okay. If you have round, arched brows. If you have heart face, try rounded brows. So these are basic. Clear ho gaya? This is clear that which type of face, which type of brows to make. Okay. Now I told about if you use iron oxide as a pigment. So because of the three color which is present, red, yellow, and black. So that can actually, there can be dissemination, and it can go into the different layers. And because of the sun exposure, it can fade to reddish color. You'll see a reddish tone in all the tattoos whenever they fade, and it takes even longer to go away. So why do we choose this? Then we choose synthetic microblading pigment. So it becomes even more darker gray as it fades off. Pre-procedure consultation, you should always ask the patient how long she's spending time in sun. If patient is coming from Srinagar for microblading, they all sit in this under the sun. So be very careful where is she coming from, and they have thin eyebrows. So you'll get a lot of patients from Srinagar and all to get thicker eyebrows. And then you have to ask and tell them about sun exposure. And oily skin, sweaty skin. If they sweat a lot, then there is a chance they can have leaking of the pigment. So you have to tell them to avoid any sweaty activities just before they plan to get microblading done. Laser or IPL sitting, that they are doing it on these area. If they're doing laser toning techniques, if they have a keloidal tendency, so that's not a frank contraindication. History of herpes, if there is history of retinoid based cream, because then the skin will be more irritated. So you have to stop anything like that just before a week you are going to do the treatment. So just because the patient is coming to you, you don't have to just do it. You have to always consult the patient and ask her, do proper priming, not only for peels, for eyebrow microblading also. I say do priming. Always talk to them, tell them to take proper precaution, because healing will be better. Then history of being on isotretinoin therapy. Now the recent guidelines, they do not say that you are supposed to stop them before doing, but they always ask, be more careful. History of chemical peeling. If she has done any peeling, if the skin is peeling, and then if she has done a medium depth peel, and if you happen to do a microblading, what will happen? The skin will peel off, and then the ink might leak. So consent, you always take a consent for microblading, and also take a consent that there can be slight color change. That should be there on your consent form. We can also share the ideal consent form for you. Touch-up should be done 2 to 3 weeks, and explain to the patient. Many times you'll have patient flying from another place. So tell them that they're supposed to come back reasonably. You can ask them to also come back in 3 weeks, because 2 weeks becomes too early. So you can tell them, come back in 3 weeks, we'll do a touch-up. Post-procedure sequel and care beforehand to avoid panic. You have to give them a printed out sheet, do's and don'ts, everything. If you tell them, they understand everything in your clinic, but when they go back, they forget everything. Somehow, I always get queries. You have made them understand 2-3 times. Still, they forget. They're listening pretty well, but when they go back, it goes out of their mind. So then you get the same query. This is how your tray has to look like, and you have to keep every instrument in your tray when you are planning the treatment. So there are different lines. The establishing line. So establishing line, you take the medialmost part of the brows and make a line joining the lower end of the two eyebrows. Okay, make a lower end, then left brow origin and right brow origin. Make a 2 lines from these two brow origin. This is, I'm telling about the marking. How will you mark? So when you make a rough marking, step by step actually. Right brow origin and left brow origin. So then you mark the arch. Okay. Then the baseline. The baseline we have already marked. Then the thickness of the brow is basically upper or lower ka jo marking hai. So that is the thickness of the brow. And the thickness varies from head to tail. It will be thickest in the front and then slowly starts tapering. That's how it looks the best. Then height of the arch. Height of the arch is you mark another marking from both the sides height of the arch. Just take a line from that. So now when you mark actually, you take the medianmost point, join the height of the arch, then height of the tail. Then lowermost point, height of the arch and height of the tail. So that's how you create an artificial marking for the patient when they, and you show this to the subject that this is what I'm planning to create for you. So if you do go by this technique, you'll not forget any line. Then thickness of the front brow to the height of the arch, then height of the arch to height of the tail. So like this you go. Thickness of the front brow, from the front brow to height of the arch to height of the tail. Lower also same thing. It sounds very fancy, but when I will do it, it will look very easy for you. And then complete the outline. Make the outline. Give the outline before you tell them that this is what I'm going to do for you. And always take a picture of this, what you have done as the outline. And then after microblading also keep that picture with yourself because she has consented for that picture. So always have that picture. How do you do microblading strokes? I have told you about and we learn on it. So when you start, at the starting point, you'll have few vertical strokes. 3 vertical stroke, 1 main stroke, then you have daughter strokes. So vertical stroke 1, vertical stroke 2. I usually give 2 to 3 vertical strokes. That's it. In anybody's eyebrow, everybody will look at their eyebrows after we finish this and look at your eyebrows. Look at your own eyebrows. You'll understand the best by looking at your eyebrows because you'll see what is the ideal direction of the eyebrows. So we have to simulate the direction of the existing eyebrows. So just 3 linear vertical strokes. Then I'm start curving 20-30 degree after that. So keep curving, keep going, take multiple long stroke, at least 6 long strokes. At least 6 long stroke. 1, 2, 3, 4, 5, 6. You will see as you go on, then ultimately you'll reach at the junction just before the arch, lower end, that will finish. Then you change the direction of the stroke. We'll do it, then you'll understand better. From there, it's ulta. Now here we are going up. In the last 1/3, we are going down. So if you look at your eyebrows, you'll see that. Mirror dikhana, just give the mirror. So just see that it goes down in the lateral most part. So that's a simple trick. It's exactly opposite of the last part. Post-op, immediate care, first 24 hours. Just keep on, I want you all to just keep on looking at your eyebrows as I talk. Rotate karao. De do, mirror de do. So immediate care would be, what do you do? Just look at your eyebrows, the direction of your eyebrows. Medial most part, do you see it? It's straight, linear, vertical. Lateral part, see it's ulta, exactly ulta. That's how when you draw, there's too many things which comes in your mind. Am I doing so simple technique, you will not forget this. Straight up and that is ulta. So just remember these 2 things. Everybody we feel the need this. So in fact, we can have a workshop where we do for each other. So immediate care is 2 दिन तक पानी नहीं लगाना है. No water for 2 days and no sun for 2 days. So 2 days you just be indoors. Ask them to apply sunscreen and use a cleansing milk or something to clean the face because don't ask them to splash water. After 2 to 3 days, yeah. Slow करें. Questions. Flash हो रहा है. धीरे जा रहा होगा तो उनको और भी दिक्कत हो रही होगी. ठीक है, okay. Nothing to repeat now onwards. Okay, so post-op care, most important is immediate care. What do you think in immediate care is there in any treatment? क्या होता है? Sunscreen तो we always tell everyone to apply sunscreen, right? I said water जाएगा ना, so 2 days nothing, no water. Try not to put any water around that area. So I usually don't even, many people, they tell them, okay, fine, you can clean gently. I tell them to go for simple bioderma ka the Sensibio is there. So I just tell them to clean their face with the cotton. So that takes away all the makeup or anything which is dirt also. So then they feel clean. So 2 days they have to be ready. They are not going for any party or any function. So if at all they have any function coming up and they are planning a makeover before that. So in that case, ask them to wait a month prior, minimum a month prior, because then they'll also adjust to that new look. Otherwise, you can only walk confidently if you are in that look for some while. Otherwise, you will be yourself very conscious, and people can pick that you have got something done. And what I usually recommend people, when they come to me for microblading and they have not been using anything bare eyebrows, then I tell them to at least start using micro pencil for whenever with the priming thing. No, use micro pencil. So at least people will be used to eyebrow also has a lot of memory. People will remember your eyebrows. If you show somebody's eyebrow, they'll remember invariably your eyebrows. You feel it's not very important. It's picking up down, but it's really very important. Upper part of the face. And it's become more important during COVID. Because mask, so everybody, it has gained increased recognition aspect. So people recognize you with your eyebrows. Okay, yeah. So like that. So immediate care, 2 days, no water. Okay. Wash karna hai with the normal cleansing milk or anything of their choice, but it should be dry. Wash. First 24 hours, be even more careful. 2 days, no steam, no sauna, no any jacuzzi, nothing allowed. Just tell them everything to be delayed for 1 week. After that, because the scabbing will take at least 7 to 10 days normally. It can take longer in different scenario, but usually it gets better by 10 days time. Touch-up is to be done when? I say to do a touch-up? 2 to 3 weeks, yes. Removal of micropigment, if you have tattoo, if you have somebody has gotten a tattoo done, then that's a different, we are not discussing about that, but Q-switch laser, so you can get the tattoo. Ask them to first get the tattoo removed and then do the microblading. Don't try and do microblading on the tattoo. It does not look very nice unless and until the patient has her own compulsions. She wants to, she's because I have only done for 2-3 patients as that. Basically, when she already had a tattoo, she was traveling and she was really very wanting to get a microblading done on the tattoo. So then I did it because she really wanted. And after taking the consent, because some days they can come back and they can tell you that, okay, doctor, why did you not tell me that it should not be done on tattoo? So always keep yourself very safe, and your safety is also equally important. So you always take consent for every little change and every little thing. It should be all mentioned in your consent form. So ask them to not touch their brows. Most importantly, the first week. Avoid swimming in, for the first week, all these activities to be avoided. Swimming in chlorinated water, avoiding steam sauna or jacuzzi, avoiding gymming. I, in fact, also tell them not to go for gym, because then also you sweat a lot. You don't know what kind of activities they are doing, how much they're going to sweat. So always tell them not to. Shampoo by tilting the head backwards. So when they first week mein unko bolo ki go to parlors to get the shampoo done, and always cover this area with the tissue. Then only get the shampoo done, because they can also spill. Tell them that no water in this area. So be very careful about this. Do not peel or scab. No creams with alcohol should be used. No makeup with alcohol should be used. So all this precaution looks simple, but when it comes to ground reality, you have to really explain each and every point to every patient. Keep fingers away from the eyebrows. No makeup to be applied on the healing area. The lipstick is allowed. Sunscreen is allowed. No wax threading. No Botox to be done 10 weeks post-treatment. So you also want to, sometimes what I tell them is that if you want to get a Botox done, you always get a Botox done. So if they have just got a Botox done, and wait for at least 10-15 days before you plan your microdating. And if they are waiting to get a Botox done, ask them to wait for 10 weeks. Let it properly settle. Then according to that, because that microblading is going to stay for 1.5 years. So then accordingly get a Botox done. Don't go for any tanning if your patient is usually going for sunbathing and all. Ask them to avoid that totally, especially for international patients. Final color will be viewed on which day. So patient can ask you, doctor, which day do you think I'll get the final color, and whatever I see will be sticking after that. So tell them safe side after a month. Don't tell them ki 2 weeks ke baad to main touch up karungi. Then when this totally, you tell them 4 to 6 weeks is ideal time, which I tell them roughly. I even take 2 more weeks time. I tell them in 4 to 6 weeks you can get. And always, what I feel is when you are a beginner, when you are doing your first patient, you don't know how effectively you will do and how good you will be. So then give one touch up extra complimentary. Always do that. So they'll be more happy. And you are also very sure if I leave some stroke and some stroke are not really nice. So you can compensate by doing, because we should do justice to our patient. We should make the eyebrows look better. It doesn't matter if you give one complimentary touch up to the patient, but she'll go happily. So the scab, most scabs, they shed during the first week. Complication. There can be complication like any other procedures. It can be cosmetic complication or functional complication, or symmetry, unnatural color bleeding, color fading, pain, itching, infection, coagulation, tattoo reaction. But if you are doing it very safely, nothing happens. So few simple tricks I'm going to give you now. When you do microblading, all the blades they have to enter the same plane, same time. So that's why you have different lengths. So when you hold it, hold like that. So it all make a screechy noise when you cut the skin. So there's a typical noise which you can actually hear, and that's when you are in the right plane. So when you're doing it, you'll hear a sound. So that's when you're only in the right plane, and there can be little mild bleeding can be seen, and so you keep applying. So there is also a query whether you use injections or not. I don't use injection. I just put the cream because I feel after putting injection, the area becomes thick and it's difficult for me to kind of graft it then after that. So I reapply Prilox, but I don't really encourage using injections. So there are phases of your healing, inflammation, proliferation, maturation. So basically, after 90 days, there'll be no pigment loss. Nothing will happen. After what you have got at 2-3 months, that will stay for a year. So inflammation, proliferation, we all know about wound healing. 18 to 35 days, the collagen is deposited, and after 50 to 90 days, basal membrane has completed its reformation cycle. So further pigment loss through epidermis does not happen after this time. Tips to prevent future pigment dispersion. That's also very important. So whenever they're going for any treatment, they might have come to you only for microblading, and they are going to go to their own city and take consult from the dermatologist there. So then in that case, you have to educate the patient as well, because they might forget to tell their doctor that I have done this treatment. So then you always tell them, use petroleum jelly whenever you're using any chemical. We always usually do it, but nowadays there are so many non-doctors claiming to be doctors, so they might be asking to go to one of the co-ops. So then in that case, always tell them to apply petroleum jelly, and sunscreen is important. Avoid steam, sauna, LED, we have spoken about it, resurfacing lasers and IPF. Okay. Now we have a Q&A. Which laser depends upon the, so any laser, don't do it for at least 6 weeks. Touch up karenge. If you're doing it 3 weeks, that will also take 3 weeks to another 3 weeks to have a pakka color. So I say after 6 weeks. So now we'll now choose a shape which suits your face, and accordingly start taking your patients for microblading. Yes, please. Any laser, any laser. Wait for 6 weeks. If you're doing like yeah, please. Marking. Go by ideal way. Like I will tell you, if there are no medial line, then in that case you go from LNASI medial to the medial canthus. Just medial to the medial canthus. We'll do the marking. Prior to microblading. Okay, so you'll be able to give a better shape, because this extra hair, I feel they interfere with the, otherwise what in the parlors what they do is they tweeze and stuff, but we can't do all that. So you have to tell them to always get the threading and then come. So and 6 weeks. I tell them 6 weeks. I delay everything because you never know. Sometimes they also put their mouth in the thread and that they do all that. So you have to typically avoid any chance of infection. So ask them to wait for 6 weeks. Because your eye, anyways, they will not even need to do it, because the eyebrows which is present, that will give a perfect shape, and it looks darker before. So then after that, the pakka color comes in 1 month, so it looks more dark initially. So then after that, whatever color they have, that will stay for long. And I wanted to say something, I forgot. Okay, anyways, we can. There are, but Indian patients may usually depends on the skin tone also. If somebody is fair, what I usually go for is dark brown. Black does not look natural. And yes, when the patient is coming to you, ask her to come with what she's normally, people are always using brush and all. So ask her to come how she makes her eyebrows naturally. So make her do that, and then that will act like, you can actually understand what kind of shapes she's liking on her face, and then you can educate her what will look best on her face, because she might not know, but when you tell her that this is what will look good on her, and if you're on the same page, she's in sync with it, she's understanding, then you can take up that shape. Any other question? Marking you all understood, no? Glabular line, medial line, lateral line, and the highest point of arch. So now just look into each other and just look at the eyebrows, and just in the mind just think about the marking. You can do on each. Thickness of the brows. So nowadays, what people want is thick brows. But you know, if somebody has a very small face, like I will do for her, she has a very small face. So it's a very different. I'll show you. She's sitting back. So in that case, now you don't have to make very thick eyebrows because she will not be able to carry it because the face is very small. So when the face is very small, don't go for too thick eyebrows. Doesn't look nice. So you have to maintain the. In fact, eyebrows also has a golden ratio. So the 1:1.6. 2/3 part is the ratio between the highest point of arch is 1:1.6. So that you have to, a golden ratio is there also. So you can measure that. And when you draw it, show her this is what we are thinking. And you know, if she wants little tweaking, always do that what she is wanting. Don't force that she will look, this is only the right thing, this is how it should be done. So just be little. Shall we do the marking now? Hai na? Where is Dr. Varun? Okay. Half an hour to ho gaya, 45 minutes ho gaya. So you can come on the way of our train.
मैम उसमें वापस नहीं जाना ना।
नहीं अब तो नहीं जाना, प्रेजेंटेशन हो गया।
ऑनलाइन फोकस रखना उसके ऊपर, ठीक है ना मैम का ये हटा दो।
हाँ तो आ गया
बैकग्राउंड इफेक्ट करो, स्विच कर लो नॉर्मल, वापस इसी पे जाना, स्विच होता रहा।
जो कि आप पूरी ट्रे लेके आओ।
आप ऐसा कर लो, सीट पे बैठ के कर लो आराम से।
मैं कर लूंगी, चेयर बनाती है वो भी स्टिल वाली वो वाली बैठो।
अभी मेरे वापस ले आप ना 3 लोग इधर आ जाओ, 3 लोग उधर रह जाएंगे तो इक्वली डिवाइड हो जाएगा, सबको इजीली दिख जाएगा। ये करेगा दे दे।
Even I have
ट्राइपॉड अगर आपको लगाना है तो वो भी है, उस पे तो और लंबा हो जाएगा, यहाँ तक आ जाएगा ऐसे।
तूने लॉक किया क्या?
नहीं मैंने ओपन किया।
इधर हो।
So, I will just show the marking first. Then we
स्टार्ट करते हैं।
नहीं कैसे चाहिए?
So,
वर्टिकल एक मिनट मैम, एक मिनट मैम, एक मिनट ऑनलाइन देगा ना उस चीज को।
ये सेटअप करना है तो यहाँ पे ट्राइपॉड बड़ा हो जाएगा। ट्राइपॉड रख देते हैं।
कोई बात नहीं, तू ऐसे ही ले स्टार्ट करने में काफी लेट जा रहा है। ठीक है सर, बेटा आवाज आ रही है ना इसके अंदर गाड़ी? हाँ जी ठीक है।
Yes, start now.
यस
So, okay, so from the center of the nose, the glabular line she was talking about, just make a tiny line here. I'm just marking now, right now, and then we learn about it also. Okay, so then the medial most part of the eyebrows. So this is, I told this line has to be medial to medial canthus line. So this will be, what do you think? Anybody can tell me which do you think is the medial most part of the, what should be? What will look nice?
I think it's this.
Yes, because there is one hair which is present, but that don't go by that. Okay. So from the LNASI, you just mark this. Otherwise, a simple way to mark will be this.
I will take a point. अगर आप वीडियो रिकॉर्ड करने में रहोगे ना, असली चीज नहीं समझ
पाओगे. I will tell it again. So just understand. मैं दूसरी बार फिर बताऊं.
We'll give the video also later on, है ना? आपका मतलब सीखने का प्रॉब्लम आएगा.
Okay, so see this. This will be your, this is glabular line and this is medial line. Okay. Then highest point of arch. Where do you think is the highest point of arch? You can take the LNAs. Yeah, you can roughly also you can understand this is the highest point of arch. And otherwise, if you see, go from the mid-pupillary line. आँखें खोलोगे एक बार मोनिका, can you please open your eyes? Yeah, just see from the mid-pupillary line. थोड़ा center में देखो, ऐसे बीच में मत देखो, because it might can happen that you look this side and you'll think this is the medial pupillary line. So look straight. Somebody can point a finger here so that she, yes, yeah. So just see. This is the mid-pupillary line. So this is exactly what we were thinking. This is the highest point of arch. We mark it. We like another marker here. Then tail end. So I, like in her face, head end has to be lower than the tail end. है ना? पर इसमें देखो, it's almost, I think it will be similar or equal. So that practical variations can happen. So we don't actually go by textbook. But if we go from this line and just mark the tail end from the lateral canthus, this will be the tail end. Okay, so just a small marking here. And what I was talking about there, height of the arch. This is the tail end. Clear? Now till here everything is clear to everyone. Sure? So I will ask, tell me all the lines.
First, the center we draw directly from the tip of the nose.
Perfect.
And it will be the glabular line. Then we have the medial line that will start from ala of nasi and pass medial to the medial canthi and reach the medial most point of the eyebrow. Then we have the highest arch line or the median line that passes from the ala of nasi and mid-pupillary line while the eyes are open, reaching the tip of the eyebrows. And the last one is the lateral most edge that is from the ala of the nasi and it reaches, passes through the lateral canthi and reaches the.
Perfect. Very well explained. It means that I have explained.
Yes.
Well.
Yeah.
Okay. So now this is the height of the, this is what the length of the brow. What do you think is the length of the brow? It should not look very nice in a very thicker brow. What I feel. So we will make this much, and then you keep with the dotted line. Just give it a rough. You can join these two lines. That was I was talking about step-by-step technique. You can join these two lines. And then join these two lines.
Use a scale or like manually?
Manually. Roughly. We will use a scale also. You can use a scale as well. But this is an easy technique because it will be almost straight. And anyways, I'm going to wipe it and then make it with a kajal and show her. This is for the understanding of the lines, basically. Then you join these two. So with these two, if you join, if you go straight, so. Give a very natural look to her. Okay.
This should also be arched.
Yes.
Slightly arched.
So lower point will be the same.
Soft,
I think
only soft
arch.
Soft.
Very arch will not look
good.
Look too. So we have made it little upper level than the medial most part. So this is, in my opinion, I'm open to you people also suggesting me, but I think this will look the best on her face. So similarly, we join this.
How do we determine the thickness?
So depends on the size of the face. Okay. And that is her choice. How she wants. Nowadays, people want thick eyebrows, but you can tell her that this will be enough thickness for her face. If you go more than this, normally it will be 1.2 centimeter. If you go by that much would look nice, I think. In this, if you see, this is a centimeter scale. So only this much is 0.5. Okay. So then we join these two with the dotted. And then we show her also that this is what we are giving you. So this is how it is. We'll show her, we'll paint it with a kajal, and then we'll show her.
This tail end is coming a little bit lower than the head end.
No. Don't see the display. This.
Okay. So it will be a little bit up.
Actually, when I was marking, spread a little bit. So we will show her that this will be her shape. And look at the shape. See like this. And lowermost part, we have to give one full stroke here. And after that, it kind of goes down. Like that. Mirror, can I get the mirror? Monica, you have to tell me if you're okay with the shape. If you want any change, कुछ change चाहिए, तो आप अभी बोलोगे. This is not the final shape, but we are thinking of creating this shape for you. अभी आप बैठ के आराम से you can see. Give her a mirror. एक बार देखो. We'll make it roundish. Soft touch, ठीक है? So we'll make a soft. Everything is clear till now. So now we'll start with the stroking.
So we'll try to keep the hybrid thing when possible. We'll keep the online hybrid and the physical level. We get reviews, how it's going, what can be changed. Because people who are here can easily see in front. It's easy for us. But then managing the online event at the same time is very difficult.
Chair, please. You can hold on. So what I'm using here is, you can see this, I'm using dark brown color, BioTouch ka. So this is what is easy. People also have a instrument which they keep here and then put the ink. But here, you can use the ink simultaneously, and don't take too much in the beginning. Just take little. We also have another color now. Jyoti, where's Jyoti? Give me that.
How long we need to use, like the expiry to expiry?
1 year.
1 year.
How many patients you can do?
So in one, you can do up to 30. This is light brown, I think dark brown. So you have to always, because it also depends on how much you are wasting. People will wear 4-5 rings and then they do it. What I recommend is pura. You don't have to dip the needle totally with it. Just take very little, and then you can.
Which company?
This is you can see BioTouch. Take pictures also.
This ring comes with the pigment separately. We have to buy this ring separately.
Yes, I think we are giving you the set ring. You can use a normal petri dish also and keep the pigment, but put very little, नहीं तो waste होगा.
It's good. We can arrange that also.
These are looking nice. How to adjust the blade in that?
I will teach that. Okay, so when we are starting, we start with taking few vertical strokes, at least 4. Can anybody hear the sound? Place your ear, can you hear that screeching sound? So that's the ideal plane when you get this sound. So at least 4. Pause खोल देना. आप ट्रे को ना कहीं उस पे रख दो और आपका हाथ फ्री हो जाएगा, so that you can hold for me.
What if there's pinpoint bleeding? You need to wipe it off.
You can wipe. Not totally you can wipe it, but if there's blood, then it will interfere with the field. So that's why.
Pain हो रहा है?
Pain हो रहा है? हाँ. Sister, आप एक बार इसको, and with the other hand you can hold it like that. Stretch करेंगे. 2-point technique, and some people hold it like this. Some people can hold it like 3 points. So if she's holding, is the field clear? ऐसे clear दिख रहा है ना वीडियो में? हाँ, ठीक है. तो आप यहाँ पे पकड़ लो एक बार. तो एक नीचे, एक ऊपर. So even I have a better, my hands are free. Otherwise, you can do it alone also. So 4 stroke, 1, 2, then start little curving, 3 and 4. So I'm just following the, anybody wants to try, I can give 2 people to try. ग्लव्स है वहाँ पे, ग्लव्स पहन के आ जाओ आप. मैं टेल एंड पे ट्राई करने दे दूंगी ये वाले, बिकॉज इनिशियल वाला बहुत इंपॉर्टेंट होता है. एंड आफ्टर दैट आई विल स्टार्ट टू रोटेट. See that what I mentioned was look at the direction of the eyebrows. That's easiest way to follow the direction of the eyebrows. Just follow the direction of the eyebrows and enter all the blade at the same plane. Keep going like that and start curving. Yes, perfect. Like this, you keep going, dip, and so see this much is enough.
In case we use more pigment, is there any harm in that?
There's no harm. There's no harm, but then so much of last may we always botch it. So that time you can use more pigment. Otherwise, no need. And you keep on curving. Keep on, see, I'm curving the needle. So look at the direction. This is how you hold the needle. I'll teach each one of you when you're doing it how to hold it. But this is how you go. And now is the point where you take a turn. So see, this point you have to take a goal. You have to make 2 semicircles. Just after initial 1/3 ke baad. One, two. So curving after 4 strokes. Initial 4 stroke is straight, and see where the natural eyebrow also curve. After the initial 3 mm ke baad, it starts to curve. So you follow. I have just followed the same direction. No rocket science. Just follow the direction of the patient who's sitting in front of you, just lying down in front of you. Just keep doing that. From here, see the direction is changing. Can you see the? So I told you near the arch the direction will change. So from there, just take a piece. So now what you do is you change the direction. So you can make it like screeching sounds like this. Straight, 2, 3. When once you dip it, you can take at least 4. You can make it up to 4 times.
And always we have to make strokes on the like base till up towards up
Down.
to upside, down to up.
Down, these are down to up.
No, you can make it like this also, but you have to sit there for that. Because I'm sitting in the head end, this is more convenient. It depends on whether you're right-handed or left-handed accordingly. Just keep on making vertical strokes. I mean like this, little slant. We applied it twice actually. And don't cut any of the marking. Don't cut, because that looks really very bad. Because we are simulating the eyebrows and no 2 lines will ever cut it. So always go 4 vertical stroke, then little arch, 5 arch, 5, 6 arch, then 1 complete circle. Then 2 half circles, then after that go down. That's a simple technique. And if you don't know that much, also just look at how the eyebrows are arranged. That's the best way to learn. So in this side, actually, you wanted to try, na? I will give you. Just make 1 vertical line. Yeah, I will pull for you. You make it straight. इसको बस straight करो. Yes. Okay. Got the no. Okay. In fact, you can try the tail end. Let me do the head end, है ना? Because head end come with 4 vertical strokes. From here we start to curve.
So we have to hold it perpendicularly.
Sorry?
No, that shouldn't happen.
That should not happen. Okay, should not happen. You're fine, Monica? And then from here we are rotating, okay? If anybody wants to ask anything, we can have another question answer session.
So we have to hold it at some angle or perpendicular like.
हाँ. So ऐसे पकड़ेंगे, then you keep on dipping, 2 marking, then again dip, and with the slant, just follow this direction. Make it slant. It looks much better. It looks like your eyebrows, like the hair is actually placed. Just do that. Now we have done 1/3. We have finished. So we'll make 1 complete circle. See, the eyebrows is also making a complete circle here. Look at this point. So this is exactly the point where you make a complete half circle here. 1, then you make 1 more, 2. Okay. Then after that, then we turn down. See, you can hear the noise. That screeching noise. Can you hear that? Khach, that sound.
Just move parallelly
Yes,
along the last.
stroke. And here again you rotate because see the brows. Don't cut any point and then you watch the brows. So at tail end, if someone is interested, this part, one stroke, I'll give you one stroke. So I'm holding it, just make one like this. Perfect, exactly, very nice. And then we watch it. We have another tray. Yellow color की
I think so.
No, I think it will go.
So with this we watch it all on the. So you take this color, put it all here. After you're done. So Joby, because we have created the nick, na? So it'll all go. Reading is there, but if you are on the right plane, not there. If you go too deep, then it'll be there. Now you all want to practice now for on your sheets.
Just will take the question answer round.
ठीक है.
For the online people and then
Yeah. So
finish it off.
Okay, what strokes to be given in touch-up session? So you have to see where is it because it can so happen that some of your pigment can get washed off. So it depends upon which level. It will be different for what you see accordingly. So usually where the leakage, what I notice is on the lateral side. Medial ones are very vertical and going very way, so it usually sticks nicely. Lateral part way, there can be little leakage. Otherwise, also, if she wants more dense in the medial side, then you can do touch up again.
So if they can be a little bit overlapping and all.
Overlapping, you will see now. By then you will see the line that look like hair. You will see the stroke. You'll see the stroke. So there is always a little space in between the two strokes. So you create another one, preferably in between the two strokes. Don't try to cut. That's rule number one. And don't try to crisscross one upon the another. Don't cut any line. So that because your natural eyebrows, if you look at your natural eyebrows, they're never cutting each other line. They're always parallel to each other. So follow the same. Like if I look at your brows, they're so beautiful. You can just make two vertical and then just go slant because you don't have too much of vertical. Preferably you keep little spacing between your brows. So just go straight, then start to curve from after 1/3. Then start curving. Here it will be. This is after 1/3 is the point when there'll be 1, 2 circle. Two other circles, semicircle. So make two other circles. Then after that, go ulta. So you start with this direction, then two circles, then you go, the direction changes. Clear? We'll leave it like that for 5 minutes.
We are done with the procedure. Cool.
Yes.
Okay, fine.
We can take Q&A online.
So we will be taking some questions. So anybody has the questions can just WhatsApp us and we will take it one by one.
And if you have not understood any point, we can also, because I believe there was a little delay between the online and the live. So I might have, gone a little fast at some places. So you can again ask me those questions. So we really don't mind answering, but you have to
shoot your questions to the WhatsApp column and we'll take them one by one.
So how do we,
We have to go again. We have to choose another
so we have to understand how do we place it, somebody was asking how do we put the needle. Yeah. So look at this. There is a you see there are two horizontal. There's one horizontal, one vertical line.
Okay.
So this is the space where the blade fits in, and you have to rotate it to fix and to unfix. This is the thing, and it has to be totally, it is not moving. See, it's fixed. Though it is a flexi blade. Similar type of blade you can have U-shaped when there is add another half to this end. So then there is a U-shape. When you do like 10-15 patient after that, you can also use a U-shape, but this is good for the beginner. U-shape because when we are turning that other side down, it's easy to do it ulta. So then what question someone is asking, do you go up to down or down to up? That can be easier with the other one because the other end can be used, you can use it like upper se niche also because that will be very comfortable. And look at this, she is not even bled, even without giving any injection with adrenaline. However, if you want to, you can do that. Give little bit of adrenaline, and how I also see is that I keep adrenaline solution. वो जो हम use करते हैं ना injections, keep that ready, dipped in gauze. So if there's because too much of bleeding, then it will interfere with the because microblading it's all about the shape and structure you're creating. So dip that, and I always sister would know ask them to dip it here, so the bleeding immediately stops. That's typically I use for earlobe repair. That's very useful there. You are also using it, then yes. I think either there are two things. Either you have not understood anything, or it's too clear. So I have no questions.
There will be questions. I will be coming to the WhatsApp thing. उसको ऑन कर दे. उसको खोल ले WhatsApp खोल ले. बोल रहा हूँ ना. Okay.
But all has to be held at the one. You have to be very hold it like a pen.
Yeah, so we'll be taking some questions now. Anybody who has the questions can message on the WhatsApp group and we will take it one by one. Somebody is waiting in the lobby line. Just check. It will come over here, right? Okay.
When I did my first patient, I did. In fact, if it becomes a little over, then also you feel that the liquid. Always before starting, shake it properly because the pigment is present in there. So it's reliable. I have used.
Everybody is joining.
6,000 का चल रहा है.
And it's up to the मैम यहाँ पे question है.
Very, 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 very fine. I have been only using this. And I have been only using dark brown. Not too light.
मैम इधर आ जाइए. इधर क्वेश्चन आंसर कर लेते हैं.
बस 5 मिनट वेट करना पड़ेगा, then we find out. इसको रख दीजिए. मैं आ जाऊँ. लोगों को दिखाओ.
मेरी टीम से वहाँ बैठे हुए हैं. तो मुझे कंफर्मेशन मिल रही है. सर आपको स्पॉटलाइटिंग आ रही है.
ज्योति.
So we have a few questions. We'll take them one by one. And Dr. Anjali is.
Okay. So I'll ask it from there. Voice is over. So now Dr. Anjali is asking, can we mix the colors?
Yes. What I usually do is.
बंद करो.
चार्जर है वरुण. वरुण चार्जर कहाँ पे? चार्जर हाँ नीचे. हाँ लगा दो.
Yeah, so can we mix colors?
Yes, we can mix colors. Usually if you have like very dark brown color, you know, and you have to ask the patient what color they want. The light and dark brown can be mixed, but don't be very experimental. Some people nowadays they want orange and all. So I usually recommend just mix dark and brown and light brown. That's it. Not other mixing. Don't mix white color because you don't know how other particles. It can be very light. So I use the basic color dark brown.
Dr. Anjali is also asking that please elaborate how to determine the thickness of the eyebrow.
Okay, so thickness of the eyebrows is roughly dependent upon the shape what the person has. So your face is divided into upper 1/3, middle and lower 1/3. So when you have the upper 1/3 of the face where the eyebrows are present, if it's too broad, because you can see specific variation in the face depending upon the forehead size. Some people have a small face but a bigger forehead. For such people, you can actually use a thicker eyebrows.
Okay.
Can we give audio messages on the group so that
we will later on? If
Okay,
anybody
okay.
wants to ask any more questions later on, ma'am, you are in the group and ma'am will answer.
And when you start, always start with the slant blade. Don't start with the U-shaped blade because there are two types of blades. So I what recommend is that start with the slant blade, which is a slant, and all the needles, there are about 14 needles all are there together, but it is a slant, and all the needle they enter the skin at the same plane, same time. So that is little tricky because sometimes when you're a beginner, you are starting to hold the pen, I mean the blade, you can actually your hand has to be really very stable to make all the at all the level just go on the same plane. So when you practice on the practice sheet, practice entering at the same level. That is the key, because then the pigment is deposited at the same level. So then there'll be no leakage of the chemical. There will be no leakage of the pigment.
Dr. Manmeet is asking that which needle is to be used.
So like I mentioned, to begin, use a flexi needle. We'll give the link also to
Sure.
what needles. We'll give you the link also.
They can directly contact me.
They can. You can contact Dr. Varun. He knows he has all the products, so all the products can be procured from him at a very reasonable rate also. So you'll not only get the product, but also save a lot of money.
Okay. So, ma'am, anybody from the audience has this question right now?
You want to try? Yeah. Come, please.
Like when we are approaching the tail end, which is very thinner, still we enter all the blades at the time, or just we use the
You enter all the blades. The thickness, the last end will be one stroke. One stroke before that one stroke and below that one stroke. Because it has to look like a tail. So last end will be just one stroke, and then there are two types of stroke actually: mother stroke and daughter strokes. So where you put two strokes up and above, you can maintain like a fish herring pattern. So one stroke, then you can put 2-3 strokes above that and 2-3 strokes below that in the last part. Yeah, that's what I was talking about. That's for the micro, that's for the brushing technique. That's very easy. You don't need any extra skill, not even this much. Just mark and just brush it like that with the stroke. It just runs on the skin. So that is the same instrument, motorized instrument, which is used for the scalp micropigmentation, where you deposit tiny dots. So for the scalp, we'll not go into that topic. But the same thing, when you rub it on the skin, then that is all over, like you used a brush to shape your eyebrows. Similarly, it will just give color. It will not give shape. It does not look like natural eyebrows because there is no line which is created. So that is lips also they do. But it's very taxing because people are usually, they want to change the shape. They don't like it. That fades. So then, and it can't be changed once it's there. So be very sure before booking one for lips. Sorry? Kits for color, pigments. There are many brands. See, this is Tattoos with Me. I have another brand which is Flexi Blades. So Flexi Blades is what I have used. This is also. Yeah, sure, please. You will have to practice also now.
Okay. This is the one we just used.
Yes. This is another one which you will use now. You will use it right now.
We have everything. So, ma'am, what do you be basically charging for all these procedures to the patient?
So, you should, how I charge is 60,000 per sitting. I include another touch-up also. So 60,000 is what I charge. Okay.
That is a Delhi price. So, ma'am, can you just...
you should not go less than 30,000. That's what I feel. You should not go less than, because it really needs 1.5 hour to 2 hour of your skill. And if somebody wants a very, perfect eyebrows, it can take longer, because she had a small face and we were doing a thinner face and less thin eyebrows. So it took little less time. Otherwise, I think you should definitely charge 30,000.
And any major complications you have seen in this?
Infection, little scabbing, and some people can pick up on that. So you have to be very sure about if they have acne scoria also on the forehead, then you have to be figuring this in your mind that they are the ones who are going to pick up. So agar koi microblading ke liye aaya hai and they have acne scoria on their face, they have this habit of picking up their brows, their face, and then acne. So they can also pick up on their scalp. So give them anti-allergic and tell them not to touch, because then they can scar very badly.
Antibiotics also have to be given?
Antibiotic not really needed. Topical also is just T-backed is what is recommended, and that's it. We don't give any oral antibiotics because we are just creating sterile techniques. So we're just creating tiny nicks, so it's not needed.
How many days these you need the sittings back again?
So touch-up has to be done in 2 to 3 weeks time, and
3 weeks.
3 weeks.
faces once again.
Then after a year you can do it, but touch up has to be done. Yes. Stay the same, na, because the residual pigment is there, but you have to change the stroke direction accordingly. And that pigment is gonna go. Most of the pigment will 70%, 80% will be washed off by then. So then what you're seeing that time, the treatment depends upon that present situation.
Post procedure, can I wipe this off?
Yeah, in 10-15 minutes we can wipe this. Normal, you can wipe with the normal saline water, dip it in it. So
that will be all from questions from here. And we have answered all the questions on the WhatsApp group also, and here on live also.
Not
anybody
needed.
who has any queries left anymore, you can just WhatsApp us, and that will be all for the online session. And we'll be going ahead for the hands-on. Thank you so much all for joining. Thank you, Rashmi.
Thank you so much. Thank you everyone for your patient listening. And if you have any queries, we'll answer it again. And I have in fact shared my contact details. So if you have any query in future also, you can always feel free to ask me and I'll answer your questions.
That's very kind of you, ma'am. Thank you so much for taking time out and giving this beautiful presentation and such a nice hands-on. Thank you so much everyone for joining. Take care.
Leave curtain.
Yes.